Hello, differential diagnosis students. This is Dr. Kamel again, and a new MPT style question. We talked in our lecture about hematologic disorders, and we talked about different blood disorders, and also what is meant by coagulation cascade, and so on. So this question might be related for today. So let's go through this question. A physical therapist reads in the medical record that a 58 years old male patient was recently prescribed a thrombolytic agent, which condition would be considered a contraindication to this type of pharmacological agent. Number one, myocardial infarction. Two, hemorrhagic stroke. Three, pulmonary embolism. Four, venous thrombosis. So let's look first. What is meant by thrombolytic agent? Thrombolytic agents are a group of medications which facilitate the dissolve or dissolution of a blood clot. Through what? Through the conversion of plasminogen to plasmin. Plasmin breaks down the blood clot and allows any occluded vessel to reopen again and to restore the blood flow. What are the side effects of the thrombolytic agents? It might lead to hemorrhage and cardiac arrhythmia. So physical therapists must be aware to avoid situations which might cause any trauma to the patient. Why? Because the clotting activity is not within normal, so there will be easy susceptibility for bleeding. Okay, let's see. So this is what's meant by thrombolytic agents. Let's go through our options. What is myocardial infarction? We call it a heart attack. Okay, when the blood flow through one of the coronary arteries within our heart is severely, occluded, or the blood flow is severely reduced, or completely stopped, like there is complete obstruction, not partial obstruction, what will happen? Tissue death. Okay, in the one of the portions of myocardium supplied by this blocked artery. Okay, what's meant by hemorrhagic stroke? Stroke has two main causes: ischemia or hemorrhage. So hemorrhagic stroke is abnormal bleeding in the brain due to rupture in one of the blood vessels. What is meant by pulmonary embolism? Pulmonary embolism is a condition where one or more arteries in the lungs become blocked. What is meant by venous thrombosis? Venous thrombosis is a condition characterized by formation of a blood clot or thrombosis where within vein, mostly where in lower extremities, in lower extremity. So what is the correct answer? Correct answer is number two, hemorrhagic stroke. Somebody already who has, hemorrhage, and they given thrombolytic agent, so this will increase the hemorrhage and will be a major problem. Okay, so thrombolytic, agents are indicated for management of ischemic stroke, not hemorrhagic stroke. We have two types of stroke, hemorrhagic or ischemic. So thrombolytic agents are indicated for ischemic stroke, not hemorrhagic stroke. So this is answer. Let's go and see what other options here. Why number one is not correct? Thrombolytic agents are indicated as a management option, for this condition, as well. So it is not contraindicated. Okay, so it is not contraindicated. What is contraindicated? Hemorrhagic stroke. but myocardial infarction, it is okay to use thrombolytic agent. Pulmonary embolism, again, quick and prompt treatment with anticoagulants and thrombolytic agents is indicated. Why? To reduce the risk of death from pulmonary embolism. So it is not contraindicated. Venous thrombosis. So again, thrombolytic agents are indicated as a management option for this condition. The only case here from these options we cannot use thrombolytic agent is hemorrhagic stroke because it will lead to further hemorrhage, which might be fatal. Thank you, and I will see you again in new questions soon. Good luck.